Our next speaker is Rosemary Ryan. Rosemary is a mental health engagement lead in the Midwest. She is originally involved in the engagement as a local forum member in the Midwest and motivated like others with the experience of the mental health services to be part of improving the service for others. So Rosemary will be speaking about the engagement process from the point of view of the supporter. So welcome, Rosemary.
Hi, thanks for having me here today. I just wanted to give my perspective on what it was like getting involved in a forum, because we would have had experience over many years in the mental health service where engagement wasn't really a thing. So what the forum meetings are like and where it fits and connects into the mental health service. We would have had difficult experience at times and for various reasons, and as a family would have made efforts to give feedback or be engaged and gone about it the wrong way, maybe at an appointment with a consultant, or it's not the right place, so didn't go anywhere for that reason, and just real frustration with not being sure of how to help or get out of the way at times. So I would have seen a forum notice, and it was just a note up people with experience of the services who wish to voice their experience for the purpose of improving the service for others. So I jumped on it, and I was speaking to the area lead at the time, and a very good conversation. So I found myself in a forum meeting, and I just had a huge sense of relief. I didn't say too much in that meeting, but just hearing others who'd have a shared experience, different perspectives, but of, things not being right or the way that they should be, and discussing solutions. So that was a huge relief to me, and much wanted. So just our meetings, for people that aren't involved with a forum, we, in Limerick, sat around together in a room. This meeting was facilitated by the area lead, and it was a space where you could chat, confidential, but a social part to it too. Halfway through we would have a cup of tea, and we'd have an agenda, and typically there might be an update on service developments from the area lead, or a question that we had asked, or information coming back to us, or a question being asked of us for our feedback, which was great to actually be consulted. And people could raise matters and share their views respectfully, because obviously everyone was coming from a slightly different angle, and just overall that the aim was service improvement, I found tremendous. So great relief in being in a group with shared experience there, and focused on recovery. But in problem solving like that, we did some other things which I think were brilliant. We often would start a meeting just stating what went well during the week, icebreaker type of thing maybe, but there definitely were times when people could say nothing. I have nothing to add at this point. But, it'd go around the room, and in listening to others, things that went well for them, and, it would just lift you to be in a group like that. And then another nice development, I thought, from a forum member's point of view, a lovely member of the group suggested that we finish the online meetings, which we had moved to at one point, with what we would do for our own self-care after the meeting. And that was a great ideas sharing thing. So people would say, we're going to log off here in our lonely little laptop or tablet or whatever we were on. And some people were planning to go take a walk, or for me, take a run, clear the head, or maybe just get stuck into a book that you had in mind, and that would prompt other people, this recommendation, this is a great book. And someone living in West Clare had the idea that she said it's just brilliant to just go and take a dip in the sea. So if there's any cold water, swimming people, she definitely turned people on to that in our area. But that was from the forum members. That was a really nice way to finish up the meeting, because, you're problem solving. It's nice to have another focus. So, for example, one of the things we identified that need to change was around communication. There's now an appointments policy which is going through approval in the Midwest based on our feedback. And one of the little things there was there's standard letters that go out, and the wording of them sometimes just can come across harshly, and that wouldn't be very engaging. So we discussed what would be better wording, would be received better and would result in better engagement. So and that could feed right into a policy that will be in place. So I think it's just highlight to me that now that service user, family member carers, that our input is central to positive changes, and that will be embedded in the service for people going forward. And you can't see this little tiny picture, but there is this structure of engagement now, which I did feel was very much missing, where the forum members, whatever our items we raise or things that we work on, can go up to the management teams, and there's an area forum where organisations are getting together also for the same purpose. And now I find myself in the hot seat as the area lead, where it's my business to make this feedback become actions and outcomes. So I definitely feel honour and a bit of pressure in that role, but just being that conduit through which service improvement happens is very empowering. So that's probably all I wanted to say on it, but this engagement process and process of change can be slow, but I think that good and lasting change, if it takes time and time is needed, that's fine. I share a quote with you that I often fall back on from St. Teresa. It's patient endurance attaineth to all things. And I cling on to that at times to keep moving forward. So that's all I wish to say. Thanks for your time.